The time being 6:02, I'm going to call this Board of Health meeting to order. All members are present with the exception of Melissa Pond. Now, there we go, okay. First item on here is the Pledge of Allegiance. So if anyone would please stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right. First item on our agenda is COVID-19 update. We'll turn that over to Marty.
All right, thank you very much. So I'm kind of happy to report that our cases are trending downward for the first time since the middle part of last month at least, which follows a trend nationwide and statewide that the cases are on a downward trend. So I'm happy to start with some good news for once. Currently right now we have 17 active cases. Our average age for those cases is 37.2, which brings our total cases to 2256. There we go. Our zero that we have 3 cases from the ages of 0 to 18. 2 of those cases are eligible for vaccination. 1 has been vaccinated. The average age for that population is 11.3 years old. From the 19 to 64 age range, they have 12 patients, cases in that age range, and 5 of those are vaccinated. The average age for that was 38.2, and cases 65 and older, we have 2 of them, and neither one of them were vaccinated, and the average age was 70 and a half. Of 16 cases, 6 were vaccinated, so about a third of the cases in town were vaccinated and had breakthrough cases. Like I said, trending downward nationwide, which is really good. Also, the hospitalization rates are trending downward, and we expect the deaths to continue to trend downward, but that's a lagging indicator. It usually takes a while for that metric to catch up. And as always, we choose preference is the prevention, so that's why we are big vaccine promoters. But the FDA and, I'm sorry, not the FDA, Merck did announce some really good news. They announced they're submitting an FDA application for a new antiviral that can be used against COVID-19. I am reluctant to pronounce it. It is molnupiravir. If approved, high-risk people would get 4 capsules twice a day. In the early days of their the risk of hospitalization or death in half, and follows the trend of 2 other antiviral pills by Pfizer and another corporation. And they could be approved within the next couple months, which is really good. It is, another fighting chance against COVID. I don't know if you, just for real quick, so there's 4 basic ways that we kind of attack the viruses, and this is a really broad oversimplification, which is kind of like for just education. We block the virus from replicating, and one of the ways we do that is with these antivirals. The only one that's FDA approved currently is remdesivir, and the only way to get that is IVs in hospital inpatient, right? And what that really does is just speed up recovery. The other way is we do that the same way the body does it by that's the monoclonal antibody therapy that I'm sure everyone has heard of. We can also keep our own body systems from overreacting by the corticosteroids, the anti-inflammatories like dexamethasone and those kind of things. Given too early, it can kind of make it worse. So that's one of those things you kind of have to, that is a physician-based, you're already inpatient, that's when you're going to get that. And then things like vents, body positioning, turning, making sure that they're on their stomach and breathing like that. These treatments are very, very difficult to make. So that's why there aren't a lot of them. And that's why there's just not a lot of antivirals in the market as with. That's really all I got for the COVID update. Yes, ma'am.
So I have a clinical question that just came up. So if we need to table this, I understand.
Okay.
I recall earlier in the year when we talked about breakthrough cases, there was a correlation that breakthrough cases were kind of correlated to patients that had like an underlying condition. And so what I'm wondering, is that still kind of the true trend, that breakthrough cases still seem to correlate with underlying conditions? Or I guess I'm curious because the Delta variety has kind of mixed things up.
So that's kind of a difficult question to answer, sans statistics in front of me.
And we can definitely table it for another
the,
time. It just occurred to me here.
From case investigation in Abington, the vast majority of the breakthrough cases have had underlying health conditions and or they were sequenced and they were Delta. So it's kind of like one of those things that I could give you an answer, but I would much rather give you the actual statistics after I find them.
Absolutely. I don't think speculating on clinical questions, it's just occurred to me now. Didn't occur to me before the meeting, but I appreciate you giving it a jab.
No problem.
Any other questions from the board on the COVID-19?
Positivity rate is also on the downward trend. I was going to bring that up at the vaccine percentage, yeah. That's 3.79 positivity rate for the town, and that's also on a downward trend. Thank goodness. We like that number low. And that's not what they, I can move on, Aaron, if you want me to move on to the vaccine update, I'm sorry.
Assuming there's no other questions from the board, I'd be happy with moving on.
So our vaccine update, like I said, the 3.79 positivity rate is much better than last week's. Also, that's not with a decrease in testing. I don't know where that statement's coming from, that they're doing around the same tests or more currently. And so to have a lower test positivity rate in this climate is really great, and I hope it continues to go down, and it should, because it's a rolling 2-week average, and it's another one of those things that's a lagging indicator. We have 68.86 people in Abington who are eligible to be vaccinated who have been vaccinated. That brings us to 59.5% of everyone, and despite or regardless of your eligibility. The world has given 6.33 billion doses of COVID vaccines of one type or the other, and 45.7% have received at least one dose. That's worldwide. We still have vaccines, so if anybody is interested and they have not got one, please let us know. We will absolutely help you get your vaccine. We expect the EUA for the 5 to 11s very soon. That will likely be a smaller dose, so we will be dependent upon the state delivering more vaccine to us, unless they allow us to use the already approved Pfizer doses that we have in smaller dose increments, and I don't know. My guess is we will have to get new orders in. We really want to try to help the schools to get to 80%, and I think we can do that with the 5 to 11 EUA coming out soon. And then just a reminder, 80% in any one of the schools means that they can remove masks for vaccinated personnel or students. So that's great. So we will definitely hold more clinics. The last couple have not been very well attended, so we're working on scheduling some more, and I imagine we'll have a lot more interest when the 5 to 11 gets approved. And let me see here. Yeah, help us get there, please, more clinics. Cases. The United States is 48th worldwide in vaccination rates, so I think we can do better. That's per capita, obviously, right? And our supply is not our problem. As far as our vaccination goes, we are fighting misinformation, obfuscation, misrepresentation of facts every day. So if I encourage people, if they have any questions or concerns about the vaccine that they want answers for, or they can happily, call me, send me an email. I will do my best to get back to you with some scientific facts or whatever it is. And if anybody has any peer-reviewed study that they think are relevant, send them my way. I will happily read them, and maybe we can have a discussion about why the results that we're seeing are different. And that's it. When we talk about vaccine and when we talk about these kind of things, we base our recommendations on 3 things: the science, the research, and evidence-based best practices. So I encourage everyone to give us a call or send us an email.
Thank you, Marty. Any other questions from the board? Okay, Marty, I did have one question. In comparison to other local communities nearby, where do we stand? Do you have an idea?
Tracking almost exactly with the surrounding communities. We had a meeting with the Brockton mayor last week, and Our percentages are about the same as our surrounding communities, except for Easton, which has Stonehill College, and that kind of skews their numbers lower because they're doing a lot more tests at the school.
Thank you, Marty. So we can move on to our next agenda item, which is the flu clinic update. That is again, Marty.
Yep, we are still doing flu clinics Monday and Wednesday, 9:30 to 11 and 2 to 4 in Town Hall. If you want one, please come get them while our supplies last. You have to pre-register for that, and those links have been sent out. If you don't pre-register and you want to get one done anyway, come to the health department's offices, and we will just register you there, or we'll help you register at the Meyer Room. We're also doing with the Council on Aging every other Thursday from 11 to 12, and the next one is October 14th. And hopefully we'll have more doses in. We do have the higher concentration for our elderly folks. We do have the pediatric one, and we do have the adult one. So we have all three. Let us know if you want one.
On the flu clinics, how are you guys doing in the health department with staffing, and can you use extra hands?
I would never say no to that.
But I mean, I know you guys have been working
Well,
crazy
yeah, I mean,
hours.
well,
Are you
so-
burned out and needing help, or?
Luckily, we have me and Lindsay are both qualified nurses, so we can give them at the same time. So, you know, if one of us is unavailable, the other one picks it up. But we have not had a bum rush of flu shots, so hopefully we can keep up with the pace.
All right. Well, thank you both, because I know with the pandemic, you guys have been certainly stretched these last
Won't be for lack of
year.
trying.
To add to that, please get your flu shot as well. Please help try and keep the burden off of our medical facilities during this time. Any other questions from the board? Comments from the board? No, thank you. All right, next agenda item is illegal dumping. We have been having some issues, if I'm not mistaken. Is that correct, Marty?
That is absolutely correct.
Yeah. So the board has a copy of our regulations regarding illegal dumping. If you have items that you are going to leave out and you want taken, you can always contact Boston Carting. Let them know. 617-541-4009. You can call Boston Carting. They will do a bulk item pickup, I believe, for $35.
$35 per bulky item, and they normally pick it up on your regular trash day.
So in front of us are the illegal dumping regulations, just for the board to view at this point in time. If there are any changes or updates we'd like to make to this, but it is really for our review at this juncture.
Basically, if you could stop leaving stuff by the curb. And
Really, this is the opportunity just to emphasize that. Please, please, please don't leave stuff out without letting the proper authorities know. Any questions or comments from the board on illegal dumping? Kevin, do you want to just grab the mic? Thank you.
People need to, make sure that if they do have bulk items, to pick them up, to not dump them on Chestnut Street or some of the other places that we commonly see, things dumped on, and we all know those spots. So I think, if people just, pay the $35, get that bulk item taken care of, or, use some other vendor that can take care of it as well. It's unfortunate that people do litter. I know I've picked up my share over the years, but, please don't litter, and, call a vendor to take care of your trash.
Thank you, Kevin. Yeah, please be a good neighbor. Okay. Yep.
I don't have the exact number, but it's been at least 5 or 6. And then that's like just in the last week or two, which is significantly more than we normally have.
Just for those of you who can help, Kevin's question was how many violations we had.
Yep.
Just in case. All right, on to our last agenda item is to approve the minutes for July 21st, August 2nd, and August 30th of 2021. I will give us a moment to view those if I have a motion.
unanimously, and I don't see any problem with them. I'll make a motion to approve the July 12th, 2021 minutes.
As
July
a,
21st.
You want to do all three?
Well, I just want to point out, so the July 12th minutes, I was not in attendance for, so I don't think we have enough.
Oh, we don't have a, yeah.
So I'm going to motion that we table that until the next meeting to
Okay.
approve.
Yep.
Do I have a second on that?
Okay.
I'll second that, table it.
Any discussion? All in favor?
Aye.
Opposed? It's unanimous. We will table that to our next meeting.
Okay. I'll make a motion, Aaron, to approve the Monday, August 2nd, 2021 minutes as written.
I have a motion to approve the August 2nd, 2021 minutes from Kevin as written. Do I have a second?
I'll second.
A second from Christina. Any discussion? All those in favor? Aye.
Aye.
Opposed? It's unanimous. There we go.
Mr. Chairman, I'll make a motion to approve Monday, August 30th, 2021 as written.
I have a motion to approve the August 30th, 2021 minutes as written by Kevin. Do I have a second?
I'll second.
I have a second from Christina. All those, any discussion? All in favor? Aye. Opposed? It's unanimous. Minutes are approved. Okay. Do I have a motion to adjourn?
I'll make a motion to adjourn.
A motion to adjourn from Christina.
I'll second.
Second from Kevin. All those in favor? No, any discussion? All in favor?
Aye.
Aye. It's unanimous. We are adjourned.